Before you ever feel a heart attack, your arteries have already been fighting a silent battle for years. And atorvastatin, a medication many people think is just a cholesterol tablet, is actually one of the most powerful tools we have to stop that process. Atorvastatin is one of the most prescribed drugs worldwide, but most people, even students in healthcare, don't fully understand what it actually does inside the body. So today, we're going to break it down in a clear, simple way. How it works, why it's prescribed, the benefits, the side effects, and the key things you absolutely need to know. To understand atorvastatin, we need to start with LDL cholesterol. LDL isn't just a number on a blood test. It's the main contributor to atherosclerosis, the buildup of fatty plaques inside arteries. Over time, these plaques narrow the vessels, stiffen the artery wall, and eventually can rupture. And when a plaque ruptures, you don't get a warning. You get a heart attack or a stroke. That's why lowering LDL isn't just about improving lab results. It's about reducing the risk of these life-threatening events. So how does atorvastatin work? It belongs to the statin class, and it targets an enzyme in the liver called HMG-CoA reductase. This enzyme plays a key role in producing cholesterol. When atorvastatin blocks it, the liver can't make as much cholesterol on its own. But the liver still needs cholesterol to function, so it increases the number of LDL receptors on its surface. These receptors pull more LDL cholesterol out of the bloodstream. As a result, LDL levels drop significantly. But there's more to it. Statins don't just lower cholesterol. They reduce inflammation in blood vessels and help stabilize existing plaques, making them less likely to rupture. This is the reason statins save lives, even in people whose cholesterol numbers aren't extremely high. After swallowing the tablet, atorvastatin is absorbed in the gut and processed mainly in the liver, which is its main site of action. It's metabolized by the CYP3A4 enzyme system, which means other medications or foods that affect this pathway can change atorvastatin levels. For example, clarithromycin, itraconazole, and even grapefruit juice can increase its concentration in the body, while drugs that induce CYP3A4, like carbamazepine or rifampicin, can decrease its effectiveness. Atorvastatin also has active metabolites, which contribute to its long duration of action, allowing it to be taken once daily at any time of day. Now let's talk about side effects. Most people tolerate atorvastatin very well. Mild muscle aches are relatively common but usually manageable. However, severe muscle pain, weakness, or dark-colored urine may signal a rare condition called rhabdomyolysis, which requires urgent medical attention. Occasionally, liver enzymes may rise slightly, though actual liver injury is extremely rare. There is also a small increase in diabetes risk in some individuals, but this risk is outweighed by the cardiovascular benefits for the vast majority of patients. So who benefits from atorvastatin? People with high LDL cholesterol, anyone with established cardiovascular disease, diabetics, and individuals with elevated cardiovascular risk scores, such as ASCVD or CRISC, are often recommended to take it. The goal isn't just to improve cholesterol numbers. The real aim is long-term cardiovascular protection and plaque stabilization. Atorvastatin isn't just a cholesterol-lowering pill. It's a preventive therapy that works silently in the background, reducing the risk of heart attacks, strokes, and other cardiovascular complications. It helps stabilize the arteries before problems occur, and for many patients, it becomes a key part of lifelong prevention. If you want more clear, evidence-based explanations of medications and healthcare topics, make sure to like, subscribe, and follow for more pharmacist-led breakdowns.